Why am I getting pelvic floor cramps is the question you asked. Let's explore the different reasons why cramp can happen. Pelvic floor cramps could be as a result of nerve issues. It could be as a result of stress. It could be as a result of pelvic instability. Put that aside for a second. We're going to come back to that. It could be from other conditions like endometriosis. It could be sexual dysfunction. It could be so many different things that could happen. The reality is, when we keep chasing the why behind these things, we can very quickly see that the environment that this pelvis is sitting is not the best. So when it comes to complex chronic conditions, by the way, you can have like interstitial cystitis. Basically, your bladder is painful. I mean, we have so many different diagnoses for different conditions, but to me, what it boils down to is the environment is not suitable for this pelvis and anything related to this pelvis to function properly. So I can keep chasing the symptoms, or I can provide more suitable environment for this to flourish. So when we bring it down to the basic, we see that the best environment is when we have stability of the pelvis. When we have stability of the pelvis, we have no reason for the muscles on the inside to go into a cramping condition. We have no reason for these same muscles to be weak. We have no reason to compress. Well, I shouldn't say no reason, but we minimize the number of reasons to compress the internal organs that exist here. Granted, we're not talking about conditions like you could have some kind of a digestive issue that can cause intestinal issues that can then make the environment unhealthy. We're talking from the biomechanical perspective. And when it comes to biomechanical perspective, we can involve the nerves, we can involve the blood vessels, we can involve muscle tonicity, muscle strength, movement. All of those are being compromised, and a lot of those are the reason why people have pelvic floor dysfunction. So these things are happening as a result of pelvic instability. And when I go about trying to bring stability there, I always start with biological breathing. If you have not subscribed to my channel, you have no idea what that means. But if you have, thank you for having subscribed. And if you haven't, please make sure you do now. You can also search my channel to see what biological breathing looks like. We'll make sure we put it at the end of this video. When the muscles inside work with the structures outside to stabilize the pelvis, then those same muscles will have no reason to be tight, no reason to be weak. The way nature takes care of these, the tonicity and the strength, is through biological breathing. When you breathe in correctly means when we study human babies, we see they all breathe the same way. We see that that type of breathing allows these muscles to relax when they're breathing in, and all of them in sync contract to breathe out. So every breath, and on average, if you're not super active, you're just, active a little bit, 22,000 times a day, you breathe and you condition these muscles. At that frequency, that should be a dead giveaway that the tonicity and the strength of these muscles are essential to your existence. Now, when we do biological breathing and we start working on exploring how we're moving, because clearly we've become dysfunctional in our patterns of movement, which have led to pelvic instability. So how your legs are connected to the socket, forming the hip joints, how your spine is connected to your pelvis, impacting its stability, how the joints of your pelvis move together, how your posture is, play a huge role on pelvic stability. So we're going to have to address every single aspect of it. And the way I go and do about this pelvic stability with my patients is I follow developmental exercises. Developmental exercises are the same things we all, every single one of us who are working, I mean, not working, walking human beings are all they've we've all gone through that. We all started as a helpless infants, barely holding our heads up, and somehow we became running toddlers. No bands, no weights, no gyms, no guidance whatsoever. That's because we're hardwired to do it. So why am I reinventing the wheel? Why am I isolating an area to try to work it out? That area is not working with the rest of my body in isolation. Why am I going on the inside and try to address the tonicity of these muscles? What if the muscle that is tight, that I'm trying with my finger to address, is not at my fingertip reach? What happens next? Is this how nature takes care of this? You're going to very quickly realize that we are doing a lot of wrong things. What makes sense to me is if I provide a natural environment for this pelvis and anything that's connected to it to work and to be at, the my body parts are here to serve me. They are here to perform a task until my last breath. They're dying to serve their job well. It's just the environment's not suitable. So when you provide the right environment, when you bring the functionality into the picture, then all of a sudden a lot of the symptoms go away. I hope this made sense. I hope you put down in the comment section what your thoughts are, what your questions are, and if you have an issue and you think I can help you, please use one of the methods of contact in the description box to contact me. Until next time, take care.